if I knew that, I'd probably be doing something a little bit different right now. But you know, to me, I think the next big phase for all of this is for us to start to really become part of those conversations, to tap into the resources that we as companies have in terms of our knowledge, our expertise, the information that we provide, and start to bring this out and tap into that to be able to provide that kind of information for consumers, for people who are looking for that healthcare information. One of the things we often forget is that companies like Johnson & Johnson and other major healthcare organizations, we are companies of relationships. Isn't it time that we tapped into those relationships, tapped into that information that we have, and started to provide that back to people in a more general way?
Well, my crystal ball actually broke last night, which is unfortunate, but if I had to guess, I would say it would be continuing the conversation. There's a lot of discussion around, you know, what is healthcare's role, what's pharma's role in terms of healthcare overall. So I think it'll probably be a continuation. I don't think any major things will happen in 2010, but I think the level of comfort and the level of expertise will definitely rise in these areas, and I think we'll become a lot more, I don't want to say the word cynical, but we're definitely going to be more selective in terms of what we proceed forward with.
I think in 2010, the engaged patient will no longer be the outlier. I think what we're going to find is that many more patients are really starting to figure this thing out. And once again, that process will actually start unfolding through sites like YouTube and Facebook and other health sites. Patients like me, for instance, where people look at healthcare as kind of a series of adventures or a series of understanding. So you certainly want to make sure you continue to rely on your healthcare professional for sound medical advice, but I think you're going to get an element that maybe wasn't there before, or maybe wasn't there consistently, which is really that emotional support that patients get from other patients. So certainly a physician is the best qualified person to talk about treatment for a certain condition, but what people go to the web for, I think, is not necessarily to say, how do I treat my cancer, but how do I tell my kids I have cancer, or how do I tell my employer I have cancer? So it's really more the emotional part of the condition and fitting it into your life, as opposed to, unfortunately, sometimes the view we have in pharma is that people think about our brand all day long. And obviously that's not the case. So it's not only the fact that they don't think about our brand all day long, they may not even think about their condition all day long. And certainly for them, they've kind of fitted into their life, checked the box, and have kind of moved on. And I think we need to understand from their media behavior, from their relationships with their family, caregivers, and kind of the network they have with physicians, nurses, and other friends who may have the condition, and how they're kind of piecing it all together. One thing I've tried is not only to provide information for patients, but also provide structured decision making. So instead of just dumping on them a box of stuff or pamphlets or brochures, is really here's the information, but tying that information to key decision points. So set your criteria. What's most important to you about a particular medication? Is it the way it's taken? Maybe it's through injection or infusion. Okay, we got that out of the way. So that narrows down the field. Next, what's important? Is it affordability? Is it convenience? Is it the safety record? Is it the fact that it's been recommended by your physician? So all those things really, I think, are very personal to the patient. What is their criteria for decision making? And I think that's part of healthcare decision making. Once again, is not something we learn in school, at least not in the U.S. So if there's a way to more systematically evaluate, and I'll be honest, I think people spend more time choosing a digital camera than maybe choosing a surgeon or choosing a medication for a life-threatening illness. And I really want to be part of the process that helps to change that.
Sure. I think I don't want to discount social media in 2010, even though it's not the newest shiny object. I think we will continue to see more pharma companies launch social media initiatives in 2010, because I think they put them in their plans last year and they're hoping they get them executed, and maybe they're all stuck in legal, medical, regulatory review. But I do think some will get through this year, and we'll continue to learn from that process. I also think, another thing we heard a lot about was the coming wave of mobile communications, and I completely agree that that's something that we should be paying a lot of attention to, optimizing our sites for mobile, looking at iPhone apps, looking at other ways, text messaging, other ways to reach our customers.
Well, I think actually just over the next few years, I think there really will be a focus on measuring what really works in the real world for patients, and actually comparative effectiveness across treatments and interventions and hospitals, and really doing a better job of measuring what actually really works for patients. And I think having a patient in the center of healthcare really helps with that process.
Well, just in my narrow area, talking about what's happening online in terms of engagement. I think tools like Twitter are becoming more widespreadly used and by patients, and things like Facebook, and where people are communicating more about their medical condition online. And I don't know if it'll happen in 2010, but I hope more physicians and more healthcare providers are engaging with their patients through these tools online in the future.
I think the difference between previous years in 2010 in healthcare globally could mean a couple things. I think that technology will continue to have an impact on healthcare. In the States, there's more technology in the front end of a Walmart retail store that there is in the front end of a physician office, and we're starting to see that change. That change will continue throughout 2010, where people will show up at an office and swipe a card or give their name, and all of a sudden a clipboard with a pencil will not be the standard as it is or has been for many, many years. And so technology, bottom line, will start to be integrated within healthcare, hopefully decrease error and increase outcome.
So short term, I think we'll all spend an inordinate amount of time trying to figure out social media, only to find out that these expensive efforts, which were very time consuming, get very little interest from people, because we're out pimping our drugs and they want to talk to each other and about condition areas. But I do expect, and I'm biased, that video can change the dynamic, because it's easy. It's very visceral, it's very simple. People tend to want quick answers. So we'll still read about our health, but I think now we have the ability to engage more deeply, make them aware, entertain them, educate them, and then ultimately pitch the product.
What's happening is platforms are coming online that really enable patient engagement. Finding a patient community online is not as easy today as it will be 5 or 10 years from now as people wake up to the power of this approach. But there are an increasing number of websites where you can track how you're doing, search for good information. Google and other search companies have recognized that there's real important value in providing health-specific search tools. So I think, in my view, online is what enables it, better online tools.
I think it's a couple of things. There's a convergence of, in the U.S., trying to understand what the healthcare system's going to evolve to. There's still a lot of questions around what that is. And the change of influence, particularly on the patient side of things, as patients get more involved in their healthcare. So I think engagement is a much more flexible approach for pharma companies that's not so focused on, the doctor tells all and provides all, but there's key stakeholders across that we need to get closer to and create more of a dialogue with over time to understand what they need.